Hello, everyone. As you are logging on, thank you for joining us tonight. Welcome to the Thrive series. And just as a little FYI, as folks are logging in here, we are using the webinar platform of Zoom to protect our event. So the mute and chat buttons have been disabled. During tonight's presentation, please use the Q&A button to submit comments, reactions, and questions. And we will be starting in just a couple of minutes here. We'll give folks another bit of time to log on. Thank you.
Hello, everyone. I see that we still have folks hopping on, so we'll give folks some time to get settled in. But in the interest of time, I'm going to just start our introductions. So welcome once again to the Thrive series. I'm so excited to be with you here tonight. My name is Lissa, and you may not have seen me yet this year, but I'm delighted to be with you for this very special presentation tonight. And if you have attended a Thrive series program before, we welcome you back. If this is your very first Thrive series session, we're so happy to have you here, and we hope to see you again at our upcoming dates. The Thrive series is a collaboration between mHealth Fairview and the Masonic Cancer Center at the University of Minnesota. Today is our third session in the fall 2022 series, and we have 3 sessions remaining. Today, we are excited to hear from Dr. Thyra Fossum. Dr. Fossum is a licensed psychologist who treats adult and adolescent patients at mHealth Fairview, both inpatient and outpatient. Her treatment approach is insight-oriented psychotherapy with elements of cognitive behavioral therapy and other approaches. As always, we'll be recording tonight's session and every session so that you can refer back to the recording on our website, which is z.umn.edu/Thrive series, all one word. And that will be posted usually by the end of every week. We do edit every recording so that we can ensure all of your privacy. During tonight's presentation, a reminder to please use the Q&A box to submit your reactions, your comments, your questions. We'll be monitoring that, and at the end, Dr. Fossum will be available to answer your questions. So with that, I am delighted to welcome Dr. Fossum, and I will let you take it away.
Thank you so much. And just a minor correction, I am currently not working at the University of Minnesota. I'm in private practice. So I've graduated, and I'm excited to be here with you all tonight. So thank you for joining me. Tonight we're going to be talking about insomnia and some of the things that you can do to actively improve your sleep quality right away. I'm going to turn off my camera so that we can just focus on the slides, and we'll get started. So I wanted to share with you why I became interested in treating for insomnia. And it was after reading about and observing in my patients at the University of Minnesota, the powerful impact that treating and improving sleep quality can have on overall quality of life, emotional well-being, and physical health. At that time, I was treating a lot of health patients and a lot of people with depression, and noticed the powerful impact it had and the great research there was about especially cognitive behavioral therapy for insomnia. And we'll be spending some time talking about that. You can go to the next slide. Thanks. So I don't have any disclosures. There are no conflicts of interest in relation to this presentation. Go ahead and go to the next one. So what is insomnia? Let's talk about that a bit so we can be sure we're all on the same page during my presentation. According to the International Classification of Sleep Disorders, insomnia is when we have difficulty falling asleep, staying asleep, or awakening too early. So this happens, we usually think about it taking more than 20 to 30 minutes to fall asleep, awakening during the night and having difficulty falling back to sleep, again, 20 to 30 minutes, or awakening too early and being unable to fall back asleep. In addition to these conditions, we also expect to see in a case of insomnia, one or more of the following symptoms during the day. So fatigue, attention, concentration, or memory impairment, impaired social, family, occupational, or academic performance, mood disturbance or irritability, daytime sleepiness, reduced motivation or energy, being prone to errors or accidents, again, probably related to concentration and focus, and concerns about or dissatisfaction with sleep quality or duration. For chronic insomnia, difficulties with sleep occur at least 3 times a week and for at least 3 months. Next slide. Adults usually need between 7 and 9 hours of sleep each night. We may have an increased need for sleep while going through difficult physical or emotional periods. That is why, we might need more sleep or less sleep during particular periods of time. And it's so important to pay attention to your own experience of feeling restored or not restored following your sleep. And that's an important factor in the diagnosis. Next slide, please. Patients with cancer are at a greater risk for insomnia due to a number of factors. I'm sure that won't surprise the people on this call. First off, I want to say about half of all cancer patients do experience insomnia. So if you're having trouble sleeping, you're not alone. And over the course of their lifetime, all people experience insomnia. About half of all people do experience insomnia for some duration of time during their life. Other factors specific to cancer patients are hormonal changes related to the treatment, hospitalization and environmental factors that happen in the hospital. For example, people coming in to check your vitals. The light might not be ideal. You might have a roommate. All these things interfere with it being maybe the ideal environment for quality sleep. Pain related to cancer treatment, medications that may increase your sleepiness or increase arousal and therefore disrupt your sleep. Worry, changes in routine, reduced physical activity, and napping due to fatigue. All these things can put you at greater risk for developing insomnia. Next. So one model of the development of insomnia is pictured here. You can see the bottom yellow portion represents certain factors that make it more likely that we would develop symptoms of insomnia, and these can vary over time. This might be a stressful job, a cancer diagnosis, and dealing with the details of that, worry about other people in our lives, or a number of other factors. On its own, these factors probably wouldn't lead to insomnia. So these are low-level factors. So it's more, rather than the cancer diagnosis, it's, dealing with the details of cancer, perhaps. The pink portion of this model represents a precipitating event that leads to sleep disruption. So this can be a number of things, but it results in an acute response that disrupts our sleep. This acute response in and of itself would not be problematic in the long run. We do have periods of time when our sleep is interrupted and we're not getting the sleep we need. But what perpetuates and creates the problem of insomnia are the things that we do, these perpetuating factors that continue the sleep disruption. And so we're going to talk about those perpetuating factors, and they're often accommodations that we make to the sleep deprivation, like taking naps during the day or drinking more coffee than is conducive to a good night's sleep, sleeping in or having an uneven sleep schedule. All these kinds of things can perpetuate our problem. We'll talk about more of that. Next, please. It is common for people to experience disturbed sleep periodically. Insomnia is our body's reaction to various kinds of physical and emotional stress. Addressing insomnia is about recovering from temporary disruption before it becomes chronic. So I just love that picture. It's sort of spooky. Next, please. Cognitive perpetuating factors for insomnia include beliefs and attitudes about sleep and worry about the bedtime. They might be unreasonable rules about needing 8 hours of sleep every single night. It might be thoughts like, my sleep will never get better, which creates more anxiety around bedtime and interferes with sleep. And it might be thoughts that you can't function when you don't get a full night's sleep. Next, please. Behavioral perpetuating factors for sleep disruption are those sleep habits that interfere with sleep. These include things like watching television or browsing social media before bed or in bed, caffeine or alcohol, especially later in the day, and not having a regular sleep schedule. Next, please. Now we're going to talk about treatments for insomnia that are supported by the research. These include sleep hygiene, cognitive behavioral therapy for insomnia, mindfulness-based stress reduction also has evidence supporting its use in insomnia treatment. Next, please. So first we'll discuss sleep hygiene. You may find that many of these recommendations are things you could be working on. I'd like you to consider them individually as I go through them and perhaps write the ones down that are relevant to you. At the end, after you've written down relevant ones, maybe you can select one or two of these to start working on. So, sleep hygiene. Use the last 60 to 90 minutes of your day to wind down. This doesn't necessarily mean you're not doing anything productive, but it might be more washing dishes than reading the news. It might be taking a bath or other things that help your body slow down and your mind quiet. And you know what those things are better than anyone else. So relatedly, reduce the psychological stress before bedtime. So this reduces your physiological arousal and improves sleep quality. So it might be that it would be helpful for you to make a list of things that are bothering you, 90 minutes before bed, and then have a break from it. So it's not what you're thinking about when you get into bed. It might be listening to a story or other things that just help you lessen your stress before bedtime. Avoid caffeine in the afternoon and evening, especially within 6 hours of going to bed. Now, some people are very sensitive to caffeine and they can't drink caffeine at all or just first thing in the morning. So you really need to pay attention to how it's affecting you. Avoid nicotine. Though quitting likely will cause an initial worsening of your sleep, especially after a couple of days, persisting to some degree up to 3 weeks after you quit. So something to just be aware of. Nicotine does interfere with sleep, but there's also a price to be paid when you quit. You kind of need to power through those first weeks. Avoid alcohol use. For heavier drinkers, 2 or more drinks daily or more than 14 drinks in a week. So for those heavier drinkers who are drinking that amount, there may be an initial increase in disrupted sleep before sleep improves. And I just like to say, if you are a heavier drinker, you may want to consult with your doctor before making sudden changes in your alcohol intake. Again, avoiding alcohol will improve your sleep. But if you're a heavier drinker and your body's used to having that alcohol, you may need to talk to your doctor and make sure you do it in a healthy way. Next, please. So exercise helps sleep. It'll help your sleep on the day that you get good aerobic or resistance exercise. It will help in an enduring way if you can exercise at least about 3 days a week. And then follow the 2S rule. The 2S rule is bed is for sleep and sex. That's it. So other things, if you like to read before bed, find a comfy chair to do it in. And then when you get into bed, it's just for sleeping. So don't get into bed before it's time for sleep. And don't stay in bed when you're not sleeping or outside your normal sleep schedule. Next, reduce external noises during sleep time. You may not be aware that external noises are interfering with your sleep, but it still might be interfering with your sleep. So just keep that in mind and do what you can to reduce that impact to the degree that it's in your control. Keep your bedroom at the right temperature. Generally cooler temperatures than daytime. Our body cools down when we sleep, so we associate that cooling down with sleep. And so cooling your body down can help promote sleep because we have that association. But of course, you shouldn't be cold. That will keep you awake. So finding the right temperature for you. And reduce environmental light at night. So blackout curtains can be really helpful for a lot of people. It depends on how you are responding to the light, but generally speaking, a dark room is better for you. Next. Avoid sleeping with your pet. I can tell you that I'm guilty of this sometimes, but it does not help my sleep. So avoiding sleeping with your pet, especially when you're trying to really actively improve your sleep quality. Avoid frequent changes to normal sleep schedules. So you don't want to vary widely what time you're waking up in the morning or what time you're going to bed at night. Having a regular sleep schedule helps your body to know when it's time to sleep. Avoid or challenge worries about sleeping or daytime functioning. So just tell yourself to stop it. It can be the most helpful intervention, but whatever works for you, avoid or challenge the worries about your sleep. It's going to increase your anxiety around sleep and make it harder to wind down and get to sleep. Generally speaking, avoid sleep medication. It's generally not effective for longer term use, and then we can develop an addiction, a physical addiction to the medication, so that there can be a rebound effect when we try to go off of it. And finally, avoid electronics before bed, and especially in bed. So thinking about all those things, I just dumped a lot on you. Thinking about all those things, if you found a couple of the recommendations to work on, just choose one or two to start. For your first sleep hygiene goal, choose something that is likely to make an impact and that feels manageable to you. You can take on more challenging goals later, but starting off with something that you can be successful at and that will make a difference is one of the most valuable things we can do. Okay, next. So CBTI has comparable. Oh, did we skip one? Is there one before that? Oh, no. Okay, I'm sorry. CBTI, we're going to talk about next. The effects of CBTI for the treatment of insomnia are powerful. Initial benefits are comparable to sleep medications. However, cognitive behavioral therapy impacts excel in showing an enduring improvement for sleep. So while the sleep medications may help in the short term, cognitive behavioral therapy targets some of the root causes to the insomnia and therefore has lasting and sometimes growing impact over time. And in addition to improving sleep, there's a lot of research on CBTI treatment and is shown to improve symptoms related to both medical and mental health conditions. So CBTI is a first-line treatment for insomnia. Okay, can you next, please? So just a caveat, you may try some of these techniques on your own, but for fully implementing CBTI, I do recommend working with someone trained in these techniques. There's a lot that somebody with experience can bring to helping you with the implementation of CBTI, and things that somebody who's trained and has a lot of experience can really troubleshoot with you and let you know which are the things to focus on and which ones are maybe less important. Next. So cognitive behavioral therapy for insomnia includes these tools. So we've spoken about sleep hygiene. It also includes stimulus control, sleep restriction, relaxation, cognitive restructuring, and a wrap up where a clinician will go over each component of the treatment to emphasize the tools to help prevent relapse. So when there's another time when you have disrupted sleep, the tools to help you get back on track so that it doesn't develop into a chronic problem. Okay. I'm going to be focusing primarily on stimulus control and sleep restriction. So we can go to the next slide. So first, sleep restriction. Sleep restriction for cognitive behavioral therapy for insomnia involves reducing the amount of time in bed, and it improves sleep efficiency by reducing difficulty falling asleep and reducing nighttime awakenings. This technique reduces your time in bed, but is not intended to reduce the actual sleep you get. Next slide, please. So step one. First, you'll observe and record your sleep patterns over 1 to 2 weeks and calculate the average time spent in bed and time spent asleep. For example, Sally goes to bed at 9 p.m. and gets out of bed at 6 a.m., but she only sleeps about 6 hours of those 9 hours she's in bed. And we can calculate her sleep efficiency by dividing the number of hours she is asleep, 6, by the number of hours she is in bed, 9. And the sleep efficiency is 67%. So 67% of the time she's in bed, she's sleeping. This isn't great. We want to see her efficiency much higher, to be at least 85% or better. Next slide, please. So step 2, start setting time for sleep that is equal to the average time spent sleeping. Even if you're sleeping on average 3 or 4 hours a night, the time you dedicate to being in bed should not be less than 5.5 to 6 hours. So once you've figured out what that number is for you, set it to that number or 5.5 to 6 hours. So in our example, Sally would stay up until midnight and keep the same time for waking up as before, 6 a.m. So we always want to shorten the night at the beginning of the night and keep the same wake up time so that your body learns to expect to be awake at the same time every day. That is always the most important part. Next slide, please. So once sleep efficiency is improved over 85 or 90%, the bedtime can be gradually moved back by about 15 minutes per week until the sleep efficiency starts to decline again. So at a certain point, you're going to add your 15 minutes and you're going to find that you're awake more during the night. And that means you didn't need that much time in bed. So we back it up to where it was before. So in our example, once Sally is falling asleep and staying asleep during the night consistently, not perfectly, she could back up her bedtime to 11:45 p.m., then 11:30 the following week, and so on, until her sleep efficiency starts to go down. Next slide. So the consensus sleep diary, and the next slide, the Pittsburgh Sleep Quality Index, these are two tools that people use to track their sleep and to make this quality assessment of their sleep and determine how best to intervene. So these are two good tools. And if you do plan on seeing somebody for a sleep assessment, it's great to add this in and start completing these before you actually go into your first session. It'll cut out some time, generally speaking. I know I personally use the consensus sleep diary, the one before. So those are a couple of good tools to use and for you to aggregate the data and get kind of a sense about the flow of things with your sleep, and also calculate your sleep efficiency. So go ahead and go forward to the next one there. So stimulus control. The purpose of stimulus control in CBTI is to create more comfort at bedtimes by strengthening our associations with the bed and sleep, and to reduce associations that we may have already developed with wakefulness. Next slide, please. So step one. First, establish a regular time for awakening. Choose this time, recognizing that we're going to be asking you to do this every day of the week, not just during the work week. So it means waking up at that time on the weekends as well. This intervention will not be nearly as effective if you let yourself sleep in on the weekends, especially during this initial phase. You may be able to fudge it a bit after you've gotten your sleep where you need it to be, but during this initial phase, we want to be really strict about that. So this regular time will help your body know when to expect to be awake and when to expect to be asleep. Morning sunlight or using a light box is also helpful in setting your circadian rhythm, so that letting your body know when it's appropriate to be awake. Also, make sure that your bedroom is a comfortable space, preferably a room in which you only use for sleep and sex, right? So if you have, for example, a desk or a computer in your bedroom and you use that for work, like a lot of people have during COVID, that can create a different association with that room where you walk in your bedroom and you start thinking work. Now, if you have to do it, you have to do it. But you might think about throwing a sheet over that computer screen so that it's not something that's interfering with your associations as much when you go to bed. Next slide, please. Next, establish a regular time for going to sleep. Now, this is helpful but less critical than maintaining a regular time for awakening. Again, just like we talked about already, we don't want to set that bedtime too early. We want to set the bedtime at a time that we're going to fill with sleep. Setting a regular bedtime is helpful, but you always want to get up at the same time. So even if you decide you're going out with friends or whatever's happening and you're staying up later, you still get up at the same time every morning. And that helps preserve your regular schedule for the next night. Next slide, please. So third, if you have trouble falling asleep at the beginning of the night or getting back to sleep in the middle of the night for more than about 20 minutes, then you need to get out of bed. You can also get out of bed if you know that you're feeling wound up and you're not going to have time to fall. You're not going to be able to fall asleep because you're just not in the right mental space or physical space to do that. So get out of bed. And you stay out of bed for 30 or 60 minutes. Generally, you just decide on that time when you get up. So if you're not able to sleep, don't stay in bed tossing and turning. That's going to interfere with our associations with the bed. We want sleep to be happening in bed. So if you're not sleeping, you need to get up. Now, go ahead and wait, for 20 minutes or so. So if you think you might fall asleep, this doesn't mean don't ever be in bed when you're not about to fall asleep. It means don't stay in bed and have those and create those associations with sleeplessness. Next slide, please. Step 4, it is generally considered best to avoid napping during the day. A brief nap of 15 to 30 minutes taken in the morning or early afternoon can help reduce stress for a lot of people and is less likely to interfere with nighttime. So again, early in the afternoon or in the morning will interfere less with your sleep. But you don't want to take a long nap during the day, unless physically you just need to, in which case, we deal with it. Some days are like that, especially when you're dealing with medical issues. So after your sleep is improved, you may have more flexibility and can periodically sleep in, for example, or periodically go to bed early, maybe by up to an hour or so. But you should really follow these guidelines 7 days a week while you're actively working on this treatment. Next slide, please. So in sum, cognitive behavioral therapy is a highly effective intervention comprised primarily of behavioral changes to improve sleep quality and efficiency. I'll give you some resources for CBTI at the end of this talk. Next slide, please. So mindfulness-based stress reduction is another intervention that's used for a lot of reasons, primarily stress reduction, but it has been proven effective in helping with insomnia. So you may be familiar with the term mindfulness, but just again, since we're all on the same page, mindfulness is often referred to as a kind attention to especially the present moment. So it involves focusing on the present moment and creating a pause from the evaluating and judging that our minds are so often engaged in. This pause improves attention and awareness, reduces stress, and improves resiliency. And again, it has been shown to improve symptoms of insomnia. Next slide, please. So again, from John Kabat-Zinn, who created MBSR and has done a fair bit of, involved in a fair bit of research on MBSR. MBSR training uses a combination of mindfulness, meditation, body awareness, yoga, and exploration of patterns of behavior, thinking, feeling, and action. MBSR training is available at the Bakken Center for Spirituality and Healing at the University of Minnesota and other places throughout the world, and it's also online. I tend to think that the online self-paced MBSR training is harder to stick with. It helps to have an external structure. So an online meeting at a particular time that you have dedicated to being there can be helpful. But again, I've had colleagues complete the MBSR training. I haven't done it myself yet, though I do use mindfulness-based techniques in other areas. But I've had colleagues complete the training and patients as well, and they've found it incredibly helpful. So I'll share some more MBSR training resources at the end of this talk. Next page, please. So I've just thrown a lot of information at you. And before we wrap up, I've got a few more slides after this, but I thought this would be a good time for us to take together a mindful pause. And a very simple mindful pause is just to take 3 slow breaths. You may want to keep your eyes open or closed while we do this. If you keep them open, a soft focus is helpful. I encourage people to fully exhale before they begin their 3 breaths. And you slowly breathe in and pause for the count of 3. 1, 2, 3. And then a slow exhale. You decide how slow it should be. But maybe try to slow it down a little bit more each breath. And let's do 2 more of those. Okay, that's great. Let's move on to the next slide. So there comes a time when you do need to seek professional help. There are things you can do on your own, and sometimes they're completely sufficient. And sometimes we need extra help. So I wanted to write a few words about when we should make those decisions. So first off, it is a good idea to speak to your doctor as soon as you recognize that you're having some chronic trouble with insomnia. Not after you've had a couple of bad nights, but if it becomes a chronic problem, it's a good idea to talk to your doctor. There may be a medical factor contributing to your disrupted sleep, including sleep apnea, or even the side effects of prescribed medications. And frequently a pharmacist can help you with the medication piece. I think they're a highly underutilized resource. Once medical factors have been understood or ruled out, you may choose to try some of the tools I've described here or elsewhere. But if these tools are not working for you, or you're having trouble implementing them on your own, then it is a good idea to seek professional help. Some resources include, a sleep clinic, especially if you have unusual symptoms or there is a reason to believe that your symptoms represent another sleep problem, like sleep apnea or something else, restless leg syndrome, in addition to insomnia. Frequently, sleep clinics will have a sleep psychologist on staff that can also help you through usually a cognitive behavioral therapy intervention for insomnia. And you can also reach out to a psychologist or other mental health professional who has specialized training in treating insomnia. And I'll give you some resources to find those people too. Next slide, please. So here are some apps that are helpful. The link for the Consensus Sleep Diary, for example. Common Ground Meditation Center is one meditation center in Minneapolis that a lot of people seem to find really helpful. I haven't been myself, but colleagues and patients have found it helpful. There's a directory here for cognitive behavioral therapy for insomnia. And the Bakken Center for Spirituality and Healing. I put down the web address there, and they have a lot of information online. I believe they have MBSR online as well. So that's another great resource. And there are a lot of things online as well. Can you go to the next one? Okay, here are the actual apps. So up above it said apps, but this one is the actual apps. So meditation apps that can be helpful in reducing overall stress and helping improve relaxation and therefore sleep. 10% Happier is an app that I've found that a lot of people who don't really want to meditate or need to get the data about meditating tend to appreciate the 10% Happier app because it talks a lot about what the mechanisms are and the research behind them for meditation. And the Insight Timer app is for more experienced meditators, I'd say. It's a lot of information. It's really helpful. You can search by the number of minutes you want to meditate, the reason you want to meditate, whether it's for sleep or it's because you want energy in the morning. There's all kinds of ways you can search around it. And two other ones that a lot of people use are Calm and Headspace. And sleep apps include the CBTI Coach and the Insomnia Coach. These are two apps that were developed by the VA and intended for use with CBTI treatment, especially the Coach one. They want you to be seeing a trained health provider if you're using that one. And the Insomnia Coach is designed to be used a little bit more independently. So next slide. And now I'm ready for questions if you are.
Thank you so much, Dr. Fossum, for that really exciting presentation. I feel like I learned so much. And so I want to, before we dive into questions, remind folks, if you haven't already, you can submit your question into the chat box. Now is a great time to do that. I did see a couple come in. And so the first one that I'm seeing here, Dr. Fossum, I know you mentioned the different apps. This person is saying that they like to use the Insight Timer app, but wondering if using that app on their cell phone and seeing the light from the phone, if that is a problem at all.
So one of the things that, well, first off, if you're watching the screen, yeah, it's not ideal. But brief moments are probably less problematic. But one of the things I like to use, I use it myself, and I recommend to my patients is to wear blue light blocking glasses at night, and that's true blue light blocking glasses, so that they do happen to be in a bright light situation, or they do need to be checking something on their computer or on your phone on your app that's helping you sleep. You don't have to worry about that as much. So the orangey ones, though, you need those. I went to a presentation a couple years ago, and this guy had done the research to figure out what the best blue light blocking glasses were, and so I asked him what they were, and they're UVEX, UVEX. I think they're about $10 on Amazon.
Super, thank you for that. I'm seeing another question come in here. If you have an opinion on the smartwatch features that relay your sleep quality, if you find those accurate or if you have any insights.
my understanding of the research at this point is they're not quite there for use exclusively. I know people who've been sitting still watching television and it says they're sleeping, or people who are restless at night, report that their watch thinks they were awake and they weren't, but they move a lot at night. So I would say use it to the extent that it's consistent with your own experience with the sleep quality that you feel. Some people find them stressful. So if that's true for you, I would avoid it.
Thank you for that. Another question just came in. You recommended if you're having trouble falling asleep to get out of bed for a period of time. What do you recommend doing in that period of time where you're awake before you go back to sleep?
So I recommend you keep the lights very dim. You do things that are not boring, but not too interesting. So you don't want to get your mind going. For a lot of people, things like number puzzles can be nice. So you can actually feel your mind slowing down. It takes longer to figure it out. And some people respond that way for crosswords. I find crosswords a little stressful. I mean, I don't know, but it depends on who you are, but puzzles can be helpful in that way. I like to think about it as doing something that you're sort of passively interested in, but you're not really going to do. You don't feel any pressure to do. You're not that interested in it. So I think about my father looking through seed catalogs, and I would look through them and be like, oh, that's interesting. I didn't know there are that many kinds of, tomatoes. It would be sort of interesting, but I wasn't going to do anything with it. So keeping things low intensity. You can watch something on Netflix, if the light isn't too bright, doing something like that, but it can be, for most things, it's arousing, or it makes you want to watch the next one. And if that's true for you, then you don't want to do it. So it really depends on what it is for you that you can be sort of passively interested in.
That's great advice. You also talked about exercise and how that can help you get better sleep. What is the impact of exercising shortly before bed, and how does that impact your sleep quality?
Well, it can be arousing, right? So it can take a while it can take longer to wind down. There is some research that suggests that exercising at any time improves your sleep over not exercising, and then it's just more optimal to exercise earlier in the day. But I think it's really a personal thing. If the only time you can get exercise is a couple hours before bed, see how it works for you. It might be fine, and it might improve overall your sleep quality. It just maybe not as much as it would if it was earlier in the day.
Super. Thank you for that. Another question that we have is somebody who actually doesn't have trouble falling asleep, but their problem is waking up during the middle of the night. What are some strategies to try to fall back asleep quickly, if that's different than your other suggestions?
Right. So you do want to pay attention for middle insomnia to physical factors. Oftentimes it's pain or something else that's waking people up. And so the solution is pretty individual. But one thing that I've found is really helpful for people waking up in the middle of the night and wanting to get back to sleep is, again, doing something, that's passively engaging, not too interesting. Maybe rereading a book, but then following it up by some portion of your bedtime ritual, like brushing your teeth. We're used to brushing our teeth, and if we're used to brushing our teeth and then going to bed, then repeating that activity is going to prompt our minds to be in a sleeping mindset. So repeating some portion of that.
Thank you so much. I will give kind of a last call to any of our attendees if you wanted to submit any additional questions. Otherwise, I have a question for you here. If you can tell us a little bit about the medication piece, and I know that you said generally not a great idea, but maybe if you have other recommendations for integrative therapies, massage, meditation you've talked about, acupuncture or acupressure.
I think that's a little outside my expertise. I know about meditation, it can be really helpful. But I don't know enough about other alternative therapies to really recommend, except to say, if it's relaxing to you, it's probably going to help. Yeah, certainly massage, things that help us relax physically. Physically relaxing helps us mentally relax. So stretching, those kinds of things, yoga, those all can help us as part of our wind down process.
I like that. I like that idea. Let's see, I'll throw one last question out here for you, maybe just as kind of a little bit of a wrap up. Can you talk to us a little bit about what that appointment might look like if you go to your doctor, you go to a sleep clinic, to explain, your particular scenario, what might they be asking of you, and how best can you articulate the sleep issues you may be having?
Like I said, if you're going in, you might want to fill out, for a week or so beforehand, the consensus sleep diary. The consensus sleep diary you fill out every morning, and about the previous 24 hours. And that contains a lot of the information that that your provider is going to be interested in. They'll also ask questions like if you have a sleep partner and if they're noticing things about your sleep. Do you have symptoms of sleep apnea? Are you snoring? Do you seem to stop breathing at all? The gasping, all those kinds of things that could be indicative. They might ask about other symptoms related to restless legs. And they're also going to want to know about what's happening in your life. Like, is this time, maybe it is, right? Is this time especially stressful, and how's that impacting your sleep as opposed to, earlier, a month ago? They'll want to know about duration of symptoms and things like that too.
Fantastic. Well, thank you so much for being here with us today. I'm going to have Kaya hop back on to wrap things up for us. But before we do that, I will just remind everybody to please partake in the survey that will be emailed out to everyone in the next few minutes here. Don't forget, you'll have a chance to win that prize pack when you complete the survey. So we really appreciate your feedback. And then Kaya, she's putting information into the chat box here. So please visit our website. The quick link is z.umn.edu/Thrive series to make sure that you are registered for our upcoming sessions.
Yes, thank you. I can see my chat link didn't work, but that directly, I just submitted the next one. That will take you directly to our registration page. We have 3 sessions left in this Fall Thrive series. And I just wanted to say a special thank you to Dr. Fossum for joining us, and Lissa tonight for hosting us. We do look forward to seeing you next week, where we will hear from Shaniqua James. She is from our local chapter of Gilda's Club, and she will be giving a talk on combating depression, loneliness, and grief associated with cancer diagnoses. And she'll give us some practical and effective ways to thrive through those feelings. So with that, tonight, I just wanted to thank you all for attending, and hope that we will see you again soon. Take care.